you can, thank you, colleagues. Hope you can see me and hear me all right. Thanks for joining us today as we celebrate the launch of a special issue titled Health Equity, Access to Services and Caring for Underserved Populations. The special issue stands as the culmination of a women's mentorship program, which is a collaborative effort pioneered by the Alliance for Health Policy and Systems Research and further strengthened through the partnership of Health Systems Global and Health Policy and Planning. The program supports early career women conducting health policy and systems research in low and middle income countries, and it guides mentees in preparing a high quality manuscript for a peer-reviewed journal. Both the Alliance and Health Systems Global demonstrates their commitment to the support of individual and institutional capacities for the conduct of HPSR, and as a constituencies, women and early career researchers have been imperative to both the Alliance and Health Systems Global. So today, during our 90-minute webinar, we will hear from our health policy and planning colleague about the type of supports that journals give to early career researchers. Mentors and mentees from our current cohort will take a center stage and share their insights and experience of the program. And there will be an opportunity for you attending the session today to engage and explore together with us the growth and sustainability of the mentorship program. And towards the end of the session and within these 90 minutes, we will be launching a special issue that features the work of our mentor-mentee peers. Before I move to the housekeeping for the webinar, let me give you some context about the journey that our current cohort embarked on in this program, because I believe this will help you navigate and engage better with the upcoming discussions with the panel and then during the Q&A session of this webinar. So the third iteration of this program guided 13 mentor-mentee pairs from 16 different countries through an almost 2-year-long journey in preparing a high-quality manuscript for a peer-reviewed journal. And it encompassed various stages, starting from the initial submission of abstracts and onboarding, followed by 8 months of dedicated mentor-mentee engagement. This led to the submission of the papers for journal review, navigating through the peer review process, experiencing acceptance and in some cases rejection of the papers as well. And in the midpoint, after fortnightly online meetings and many drafts of papers, our mentor-mentee colleagues also managed to meet in person to refine papers, exchange feedback, and also expand their network. So now onto some housekeeping details very briefly. So we encourage you to start posting your questions or comments in the dedicated Q&A box, which you will find at the bottom of this control panel. And we will address those questions during the Q&A session. Please remember that this session is being recorded, and the access to the recording will be available on both the Health Systems Global and the Alliance websites. And a quick housekeeping rule for panelists and speakers today: please keep your cameras and microphones muted to help us ensure smooth presentations. Now let me invite our colleague from Health Policy and Planning Journal, Sandra Monia-Jack. Sandra will speak about the supports that journals and health policy and planning specifically offer to empower the next generation of women researchers. Sandra, I invite you to turn your camera on as I introduce you to the audience. Sandra is part of the UNICEF Immunization Economics team based in New York, and she is currently on leave from London School of Hygiene and Tropical Medicine. Sandra, so good to see you. Thanks for joining us, and over to you. Sandra, I think you are on mute.
Yes, the usual technical issue. So I was saying good afternoon to everyone, or good morning, depending where you are. So from New York. So first of all, I would like to say very nice to see this this launch of the supplement, which was very long awaited supplement and very important one for HPP, Health Policy and Planning Journal. And I still remember the buzz that was going on around the room, you know, in Bogota, when all the mentees met their mentors for the first time. I think that was really, really great, and I enjoyed this experience. So you all probably know very well the Health Policy and Planning Journal. So I used to be the co-editor of the journal, and now I'm only managing some supplements since I joined UNICEF. So Health Policy and Planning Journal, it's a journal that is really a journal that publish papers on health systems and policy, and the scope is low and middle income countries, and this is low and middle income countries as authors, but also as audience. So we are very keen that policymakers and practitioners also read Health Policy and Planning Journal. So the journal is very international. We have authors from 90 countries. Every year we have 10 issues and many supplements, including a number of supplements that are focusing on trying to help young authors in the South. And we had a few mentoring supplements over the years, and this one was particularly important because it's the first time we had a formal mentoring for mentees. So what do we do for young authors? So first of all, we used to be a hybrid journal, and now we are an open access journal. But however, we have a special scheme for developing country, what we call developing country initiatives, that basically waived the open access fees from authors or reduce the open access fees from some other countries. So this is really important to note. And this will be starting from actually now, and officially the journal will be fully open access in January 2024. So what we offer for young authors is higher copy editing if it's needed for the paper. So we basically pay for better copy editing especially for authors for which English is not the first language. We also refer authors to Author Aid, which is a non-profit organization that helps authors to improve how their paper are written. We really try to help authors to really launch their career into HPP, and so we always consider when we basically receive paper, you know, if the first author is a low and middle income country writer, and if they really, you know, maybe we push a little bit, you know, on the pushing to the review. Is the quality, if we think the quality is acceptable and the paper is of importance, for example. And finally, now we request a reflexivity statement from authors in HPP. And in this reflexivity statement, we try to look for inclusivity in the authorship. And we try to understand what's the role of the low and middle income country authors, especially, but not only, in the write-up, and to make sure that all the authors, have a real role. And we try to really kind of encourage papers and authorship teams to make sure that they really include low and middle income country authors there. So before I hand back to Nanuka, I wanted to congratulate everyone again for this supplement, which I was actually reading yesterday again. And I thought that was an amazing supplement, very diverse, and also a lot of relevant and impactful studies that are adding to the literature, which is always something we want to look for in terms of impact. So thank you very much.
Thank you, Sandra, for your insightful perspectives on what role journals can have in supporting individuals in the early stages of their careers. And And I indeed agree that the component where our mentors and mentees had an opportunity to meet with health policy and planning team in person prior to the submission, to hear your suggestions and advices about the submission and the peer review process, that was a very successful component of the program. So I very much echo your comment here. Thank you so much. And attendees, I encourage you to post your comments or questions if you have any in the Q&A box. And as we celebrate the journey and success of these early career individuals, let's now give them the floor and hear from their perspective. Our colleague, Dr. Aku Kwame, will take it from here to discuss this journey with mentees and mentors and the mentee-mentor panels. And the panels will also be joined by our guest editors. Aku, well, you have actually already turned on your camera. Dr. Aku Kwame is a technical officer with the Alliance for Health Policy and Systems Research, supporting its work on capacity strengthening and systems thinking. Aku, welcome, and floor is yours.
Thank you very much, Nanuka, and colleagues, good afternoon, good morning, good evening. Thank you so much for being here and joining us today to celebrate this wonderful cohort of first-time publishers, writers, researchers in their early careers. We want to acknowledge their journey, and I want to join Sandra by congratulating this cohort, not simply for having published their first papers, but also for really making important and robust contributions to the field of health policy and systems research. I also want to congratulate and thank the mentors who have been on this journey and who have shared their experience and their technical expertise in ensuring a new generation of health policy and systems researchers. And I also want to appreciate Health Policy and Planning and Health Systems Global. The Alliance has been in this partnership for a few years now, and we very much value this partnership, not only for the products that it produces, but also for the process and the engagement as we collectively build the field of health policy and systems research. So I'm delighted to be able to welcome 3 of our early career researchers who've been published in this really excellent supplement. And so I will call on Mariam, Victoria, and Lynette to turn on your cameras while I introduce each of you in turn, and then we'll give the audience a chance to hear from you directly. So I'm thrilled to be able to introduce firstly Mariam Chalumpa, who is a social scientist with the Accountability in Action project at Kamuzu University of Health Sciences in Malawi. Mariam, you're welcome. Secondly, I will introduce Chikmana, who works as a researcher at the Unit of Intercultural Citizenship and Indigenous Health, which is part of the Universidad Peruana Cayetano Heredia in Peru. Victoria, you're welcome. And then thirdly, I'm delighted to introduce Lynette Okoth, who works as a senior technical advisor in community health at LVCT Health in Kenya. Lynette, you are welcome. So thank you, all of you, and again, congratulations. And perhaps it would be great to hear from each of you. The audience is going to have a chance to be able to read your papers, but maybe just briefly, in less than a minute, if you could just share with with us a little bit about what your paper is about, and perhaps let us know why you were drawn to this particular topic. So Lynette, why don't I start with you? What was your paper about, and why was this your area of research? Lynette, you are still on mute.
Okay, thank you everyone. I hope you can now hear me. And as I've just mentioned by Aku, I'm Lynette, and happy to be here, happy to share about my paper. So my paper was around policy and practice and how this shapes service delivery for adolescent girls in urban informal settlements. Why it was important for me is that I've worked around in communities for close to a decade now. I have worked in maternal and child health, and for me, adolescents being a cohort that contribute to a large number in women of productive age, and the fact that we end up with unintended pregnancies early, then for me, it was a call to just action and just find out as a service provider, as a policymaker, as someone who's interacted with policy, how do I unearth what happens in urban informal settlements to be able to understand why do we have challenges in providing services for this cohort, and yet in Kenya, we have policies on adolescent service provision. So that's what triggered me to do this. And so I have very important, very key findings, and I hope my readers will be able to see this, that governance and leadership alone is not sufficient to actually provide services to adolescents, and especially around sexual and reproductive health. Thank you.
Thank you very much, Lynette, and we'll hear more from you in just a moment. Mariam, why don't I come to you next? What was your paper about, and why was this your topic of focus? And Mariam, I'll also ask you to open your microphone.
Sorry. Yeah, so basically my paper was about the complaints redressal mechanisms in the Malawi health system. Basically, we found out that there were at least 30 complaints mechanisms within and outside of it, but they actually overlap into the health system. And at the same time, through the work that I'm currently doing, all health users that I've spoken to so far had some form of complaints that the different challenges that they've experienced within the Malawi health system. So it was rather strange because it clearly showed
I think we'll just give a minute for Mariam's internet to come back.
Being underutilized, because ideally, if you have that many complaints mechanisms, then maybe the answer should be one, to address the many challenges that exist. Number two, they should be accessible to every single person that has complaints. So this paper basically explored the different barriers that exist that impede health users from accessing these complaints mechanisms. So what I can assure.
Thank you very much, Mariam. And Victoria, will come to you next. What is your paper about, and why were you inspired to focus on this topic?
Thank you. So my paper is about justice implications of the health and food security responses for indigenous people during COVID-19 in my country, that it's Peru. And well, the main results show that actually national and regional governments try to make an effort to assist the health and food needs of these populations. However, a drawback was that their livelihoods and their food systems were largely overlooked, which impaired the result of these policies. And I chose this topic because I believe that in my country, indigenous people are a largely neglected population, and I wanted to contribute for the discussion to develop better, more effective, and fairer responses for them during health emergencies.
Great, thank you. Thank you, all three of you. I mean, in just that very short amount of time, we've heard the rich diversity of topics, and yet each of them are so clearly articulating the issues of equity in a very real sense, whether it's about the justice implications that Victoria speaks about, or whether about the differential barriers to access to services, or as Lynette said, that governance and leadership alone is not sufficient when dealing with particular groups, in this case, adolescents. So thank you very much for those comments and just introduction. So now let's talk a little bit about the experiences that you drew from going through this mentorship scheme. Maybe, Mariam, I would start with you, and I would ask you just to think from a technique or a technical perspective. What do you think was the most important skill that you gained as a result of being mentored through this process of developing your paper, drafting it, redrafting it, submitting it, responding to reviewers' comments? What was the single most important skill that you learned?
Thank you very much for your question. I'm trying to pick at least one because I learned some techniques through this program. But I think one of the most important techniques, can I mention two? Okay. So the first technique that I was taught through this program was just write. Whether you have the evidence or not, just write, and then you can find the evidence later, because I think earlier on in the program, what made me kind of delay a bit was I was trying to find as much evidence as possible before starting, until I was told just write. So that really made a huge difference. And I think the second one is you can't rely on two drafts, for example. So what made the paper become what it is today is the constant redrafting and redrafting. Again, now and beautiful advice that was given to me. So yeah, to say that those are the two techniques that I learned during the program.
Thanks so much, Mariam. So you're speaking to us about momentum and about constancy. And I think that those are two really important techniques, getting that idea through the draft and actually publish. That's wonderful. Victoria, let me come to you next, maybe just building on Mariam's reflections. And if you take a broader perspective and think not just about the technical, but think about your journey, the journey that this mentorship process brought you through, what was the most surprising learning that you had for yourself?
Well, personally, I think that one of the most important learnings for me was in the International Congress in Bogota, because I am a sociologist and I am interested into health research, but I had a lot of troubles trying to find my spot, my contribution there. But in the Congress, I could see a broader perspective. I met many other researchers and study. And I think for me, the intersection between social science and health research became more clearer, and it helped to my career too.
Thank you, Victoria, for that reflection. A really important one, because one of the things that we are collectively as a field of health policy and systems research, one of the things that we value is really this coming together. And as you say, just being able to find your spot in the intersection. So I'm thrilled that this experience offered you that. That's wonderful. Lynette, let's come to you now. So you've been through this process of having been mentored and successfully published. And I'm sure that you will continue in your career as a researcher, but you'll also grow and evolve and possibly think about being a mentor in the future. So what would be important to you as you make this transition from being a mentee to becoming a mentor? What do you think would equip you or help you make that transition better?
Thank you, Aki, for the question. I think for me, this is just the first step to building a house, or rather becoming a good researcher and a good mentor. So I think what is required is walk the journey further and work with other seasoned researchers. And probably just want to take you back a little to what happened in 2022. Of course, we started this journey, but I also want to appreciate Sarah, Dile, and team. I was an emerging voice the same year. And just sitting with seasoned researchers, having other mentors peer review your document and just tell you that this is still off, you need to do something. I think the journey has just begun. And so working with someone who's just made a first step would be important. And I'm happy that my mentor is here. And I know we keep on, we have several other projects together. So just working this journey, doing a second, a third, a fourth, and a fifth paper, I think that's a journey to being a good mentor. Again, picking from seasoned mentors or researchers in the field. Thank you.
Thanks so much, Lynette, for that. Indeed, walking this journey and getting a few more colleagues and collaborators on the way. So thank you to each of you. We will, a round of applause for you at this moment. We will call you back in our second round, but for now, I just want to thank you for at least letting us get to know you a little bit and hear just a little bit about your experience as being mentees. So thank you very much. And now I want to be able to call on the second panel. So in this transition, let me begin to now introduce our second panel, which will consist of our guest editors for the supplement and then also our mentors. And I also just want to make the point that though we're hearing today just from a handful of the mentees and mentors, but through HSG and through health policy and planning as well, there will be other ways to hear voices of the other, both mentors and mentees as well. So now I'd like to welcome the second panel, and I will be introducing our two guest editors, Trisha Pennycook and Maria Latsoporas. So Trisha Pennycook is Vice Dean for Faculty and Global Affairs, and she's also Associate Professor of Public Health at the University of South Florida College of Public Health. Trisha, good morning to you. And then let me also introduce Maria Latsoporas, who is a physician and epidemiologist and has worked as a research scientist with CONICAS, the Center of Excellence in Chronic Diseases, also at the Universidad Peruana Cayetano Heredia in Peru. Maria, also, good morning to you. Let me also now introduce our mentors today, Sally Theobald and Sara Ardila Gomez. So Sally Theobald is a professor of social science and international health based at the Liverpool School of Tropical Medicine in the UK. Sally, good afternoon to you. Thanks for being here. And then Sara Ardila Gomez, who is associate researcher and National Scientific and Technical Research Council in Argentina. And she's also professor at the School of Psychology at the University of Buenos Aires. Sara, good afternoon, good morning to you. Great, so thank you all of you for being here. And as we got to know the mentees a little bit, I'd like to give all of you just a little bit of an opportunity to share some of your reflections with us as to why to engage in such a mentorship scheme. So maybe Trisha and Maria, I would start with you as guest editors on this really excellent supplement. Maybe to hear from each of you why you decided to be part of a mentorship scheme for early career researchers. And really, what was the inspiration for guest editing the supplement? So Trisha, why don't I start with you?
Thank you. Good morning. I believe that this program was what I wish I would have had at the beginning of my career in academia. That was what interested me. That was my motivation to participate in it. For those of us who do not come from traditional academic institutions where we know that publications are the coin of the realm, we do not advocate for ourselves for time protection and mentorship to be able to learn how to publish and go through the process, especially if we are more in the areas of leadership and administration, then our work is running the institution, not our own personal development and growth. And when this opportunity came to me, thanks to one of my mentors in public health practice, who connected me to you, I didn't even have to think about it too long, knowing that I wanted to be a part of it.
Thank you so much, Trisha. And Maria, what about you?
Hi, thank you. I am laughing because it was my first impression too. Like I would like, I would have liked to be part of a program like this, or have the opportunity to be part of this program when I was young, or when I was an early career researcher, trying to know more about this and understand more like the process of publication, and have someone that goes with me through this process. Second, I think that I really like that the supplement was focused on Latin America and the Caribbean, because I think that it was also like a huge opportunity for people from the region that I am part from. And finally, I will say that I am very glad that I accept to be part of the program as a guest editor, because I think that this went beyond my expectations. Like I learned a lot from mentees, from mentors, from my co-guest editor, and in general from the whole organization of the program. And I think that this is like an excellent example of what we can do to move forward and support young people, and especially women. Thank you.
Thank you very much, Maria. Thanks to both of you. So Sally and Sarah, let me come to you next. You both participated as mentors. So tell us a little bit about why mentorship is important to you and what led you to be a mentor in this program. Sally, why don't I start with you?
Sure. So first of all, if I can offer also my congratulations to the authors for this impactful interdisciplinary journal with conceptual, empirical, and practical evidence for health equity. So for me, mentorship and supporting the next generation of researchers is critical and important for all researchers, to pay it forward, to share the support we've benefited from. And I think we still see in 2023 gender bias and first authorship, with fewer women, more higher income than low income first authors. So I was particularly attracted to this program as a way to address inequity and to go on a learning journey together. But I want to be really clear that mentors really gain from this program too. So for example, for me, I gained knowledge and insight from Lynette's embedded and in-depth knowledge about the Kenyan context, about adolescents in informal settlements, the challenges that they face. And I also gained from learning across and from a cohort of mentors and mentees, and being part of an exciting interdisciplinary global network or community of practice. And I also really enjoyed learning more about health policy and planning as a journal and their innovations such as reflexivity statements. Thank you.
Thanks very much, Sally. Sarah, let's come to you.
Well, thank you very much for this initiative and this program. Well, I will say that what led me to become a mentor is that I'm a woman myself. I'm from the Global South. I'm based in the Global South, and I have faced many of the barriers that young women researchers face today in the Global South, but also at the Global North. And I am aware that I was able to overcome those barriers thanks to the support and help of many others, mentors, my family, etc. So this opportunity or this program was an opportunity for me to give back, to be part of this, I say, intergenerational solidarity. And I'm fully aware that academic careers and research careers are not individual ones. They are possible because of networks, because of support, of peers, of mentors, but as well thanks to institutional support as the one provided by the Alliance and Health Systems Global through this program. Thank you.
Thank you much. Thank you very much, Sarah. Thank you, all of you. I mean, all of you have raised really important points that we're going to try to pick a few up on in the discussion now. But you've spoken about networks, institutional support, family support, mutual and reciprocal learning. You've spoken about intergenerational solidarity. You're speaking about paying it forward and really participating in opportunities that either you had and enabled you to get to where you've gotten to, or that you didn't have and you wish you had. And that's really the impetus for being part of this growing community. So really important reflections there. And why don't we go a little bit deeper on some of them. So Sally, let me start with you because you spoke about this interdisciplinary community of practice. And I want to take that apart a little bit because in health policy and systems research, one of the values that we have is this interdisciplinarity. But when you think about mentorship and having to mentor across disciplines, and what are some of the potential barriers that can arise?
I think some of the barriers are potentially being fearful about other disciplines. Do we properly understand them? How do we engage with and embrace other disciplines? And it was really nice to hear from the mentees about, Victoria talked about being a sociologist and how she found her space through this process in health policy and systems research. And when this panel introduced themselves, there's a lot of interdisciplinarity here too. My view is that if we're really going to promote health equity, we need interdisciplinarity. We need intersectoral action as exemplified by the supplement. So as a mentor, I would say, don't be afraid of other disciplines. Read, read, read. Look at the journal that you're aiming for and read articles that bring different disciplinary perspectives to that. Look at how they're intertwined. Look at how interdisciplinarity is discussed and represented across the journal article. In the introduction, in terms of the bodies of literature that are called upon, in terms of how methods are presented and brought together or triangulated, and again in the discussion. So read, 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 reach out to others. We have this fantastic network now of mentors and mentees that embody interdisciplinarity. Let's use each other as a resource. And I think Lynette put it really nicely, let's walk a journey together with different types of researchers. So please don't be afraid of interdisciplinarity, embrace it, and read and reach out to others to help you understand the approach, the methods, and the key reading and concepts from different disciplines. Thanks.
Thanks very much, Sally, about that. Sarah, I want to come to you next because you spoke about the institutional support. I want to sort of take what Sally has just said about being fearless, about reading, about reaching out, and about embracing. But I do want us to talk a little bit about institutional supports in terms of what kinds of institutional supports are essential in order to make mentorship effective, maybe in general, but then also as it applies to interdisciplinarity. Do you have thoughts?
Yeah, thank you. I will echo what Trisha mentioned at the beginning, and is this idea of have protected time for do this job, no, the mentorship, but other issues related with publishing. And I also think that we women especially, but also men, need institutional support in order to develop our care tasks. That means that, as you know, women are the ones who are more frequently in charge of taking care of children, taking care of sick relatives, parents, etc. So I think that we will need more acknowledgement of that task that we are doing as a parallel job to the research job, and have institutional support to that. And I think that we also need to give institutional support, as I mentioned before, not only for women who are doing this, but also to men. I think that we need to start working together with men. I apologize for introducing something political, but many of you may know that this week we had presidential elections here in Argentina, and we have a new president that is from the extreme right. And he won for 12 points. And the reflection that we are having right now is why that happened, no? Why we move in that direction. And some of the social scientists are trying to explain that many of his voters were young men, no? So are we leaving behind young men for certain opportunities as well? And how can we include them also in these types of initiatives? So I think that we need to acknowledge and recognize from an institutional point of view all the care tasks that we are doing while we are doing this job.
Sarah, thank you very much for that. No need to apologize for getting political. That's part of the field. But I do want to pick up your point about men and women and how to respond to both of their care responsibilities. I should add, because I don't think that the audience will be aware, in the program, in the mentorship scheme, we do have a small handful of male mentors. Unfortunately, 2 of them were unable to be here today. So we do have a panel that reflects all women, but indeed we have had male mentors, and we will actually have some questions about that. But before we get to the issue of gender and responding, I did want to go a little bit deeper on this idea of institutionalizing supports for mentorship. Trisha, I'd like to come to you and ask you your views on how does mentorship actually get institutionalized?
Thank you again for this question. I believe that we need to start from the time our future academicians are students, in teaching them how to be mentored and the importance of being mentored, so that when they go to apply for jobs, in their questions to whoever's trying to hire them, they ask if there are opportunities and mentors that will help them grow in their journey. I think that if we don't do that while they're students and we don't model it in the institutions where they're learning, it's going to be that much harder for them to advocate for themselves from the beginning of their journey, and will lose years in trying to build a network and connections and find mentors to be able to go. Your mentors don't necessarily have to be people you know previously or have chemistry with when you're starting. They need to be people who know where you are and how to get to where they are. The other types of mentors may come later, but official mentors that are not there just based on affinity, and in many occasions, those are men. Process. The policies of protection are important, of time protection, but there's also a need to make sure that the institution sees professional development as something of value. And we know that the institution sees it as something of value because it's in their goals and objectives that their faculty, junior faculty, grow professionally. There are opportunities for reporting on the research that junior faculty are doing within the institution to help them grow and refine before they go out and present into the real world, that they're part of their official assignments, academic load. There's time there that can be measured in days, not just hours or percentages. So a day a week, a half day a week, that's protected as part of their assignment. And since it's a part of their assignment, it's part of their evaluation to know what they did with that time and the budget, to be able to protect the time and help junior faculty, especially women, be able to present. I just have a couple more points. The policies need to be disseminated. They can't be just in a handbook. People need to know that they exist and how they can make have access to these policies. And finally, as I said before, assignment of a specific mentor when they're coming in. And that means that mentors need to be trained how to be mentors as well. It can't just be that you've published 500 papers. You may not know how to teach or support someone. So the mentors also need to be professionally developed and to grow. Thank you.
Thanks very much, Trisha. And I think we'll come back to some of those points later. So Maria, let me come to you, and maybe let's now move towards this question of gender, gender balances and imbalances in mentorship. How do we promote male allyship when it comes to mentoring early career women? But also the points that, and I suppose in developing allyship, also not propagating further gender imbalances by encouraging women to take on yet more unpaid work, because mentorship has incentives but does not always have financial value. But then maybe let's also address Sarah's point about also responding in kind to both male and female care and other needs. How do we deal with these issues when it comes to mentorship, and what should we be thinking about?
Thank you for this difficult question. Well, I think that first of all, we need to work together based in similar principles that apply to different genders. In that way, provide similar opportunities. But at the same time, it's important to consider that in the day-to-day basis, women encounter more and particular difficulties, as Sarah mentioned. The time spent in care in general, it's more in comparison to men. So I think that when I say work based in similar principles and have similar opportunities for both, we need to consider this too. Also, I think that usually in research, we work as a team. So the team needs to support a woman and try sometimes to accommodate to these different circumstances, to these particular difficulties that we encounter, to try to move forward as a team and grow as a research team, as a group, etc. It's true that in academia we have these activities or tasks that are unpaid, and sometimes women are the ones that say more time yes to this type of activities. But I think that again, as a research team, as a research group, we need to try to distribute this type of unpaid labor or unpaid activities, so men and women have a need to be involved in terms of time or of these activities, and in that way I think that it will be more important and more relevant. And again, think that research groups are teams, projects have teams, and we need to distribute all these activities between all the members, I will say. Thank you.
Thanks very much, Maria. And I just wondered whether any of the other panelists have any reflections on that final question.
Just a quick thought on it. When we think about the fact that you mentioned that mentorship is not usually incentivized financially, it should be. Whether it is just in the time allocated to do the mentorship, which comes because it's on your load, then it's considered as part of what you do day to day that you get paid for. So it's either models where there's an assignment item that's directly related to how many students you mentor. Because as we've said before, women also take on mentorship opportunities, not necessarily by choice, but because of affinity. Other women will want to find women to ask them to be their mentor, and that may not be official. So making that official is important. And I believe that by doing that, there will be more opportunities for the gender equity, because it's now a paid part of the assignment and not just something that you do because you're good at mentoring. But the second part of that is the male students that are training, that are obtaining the degrees in our institutions, also need to understand the importance of it and the equity part while they're students. So just like we mentioned before, because when they grow as students with this mindset, then when they become the faculty members and the mentors, that's already part of their core values, and it's not something that you need to convince them to do. If we do this, In 15 to 20 years, we will not be having this conversation. But the students we're training now are going to be the faculty in 15 to 20 years. So if we don't start now, that means that we have more and more years into the future before this conversation is no longer necessary.
Thanks very much, Tricia. Sally, I saw your hand.
Yeah, Tricia said what I was going to say much more eloquently, and I love the way you framed it with the long-term view as well, Tricia, about investing now will have impact for gender equity in the longer term. And certainly in the institutions that I am familiar with, we do see more women taking up mentorship roles. So we need to recognise, remunerate and value mentorship in our institutional systems and structures. Thanks.
Thanks very much, Sally. And Sarah, any final thing to add?
Yeah, I will add that I think that I think that we need to start measuring these imbalances since the applications for both mentors and mentees, for example, the use of time or the poverty of time. And I think that in that way, we will start like seeing this more clear, not just talking or complaining, but seeing the figures.
Great, thank you. Thank you all. You've really enriched the time that we have today. So I want to just thank this panel, and we're doing great for time. So I think what we can do is we can invite our mentees back. We have a few questions that have come up in the Q&A box, and so we'll look at those and respond to those. But given the way the conversation is going, I mean, there are lots of threads that we can pull on to unpack this a little bit further. So Mariam, Victoria, and Lynette, I will invite you back to the panel, and you can go ahead and turn on your cameras. And why don't we now invite our audience into this conversation. I do see that there are already some questions and some comments that I think we have begun to respond to. So if I just look in the box here, I think that there was a comment about, oh, I've just lost it, about how can men participate in such mentorship. And so I think that we have responded to that. There are some questions about how to get more information on the policy fellowship, and we will give some comments towards the end. One question we have here from Joanna, which is for all panelists. If you could give yourself one single piece of advice, comparing where you've come from day one when you began, either as a mentor or a guest editor or a mentee on this program, what would that single piece of advice be? Who would like to respond to that question first? Lynette, you smiled, so why don't I come to you?
Yeah, maybe I can say this, that I think one of the single piece advice that I give to myself is that for me to remain relevant in the context of research and writing, then I think I need to keep the light burning and not light off the candle, because I think when it becomes cold, it's very difficult to pick it again. So just keep on doing writing so that you sustain the gains that are already there and build up myself. Thank you.
Thanks very much, Lynette. Any other reflections on speaking back to your day one self after having been through these 2 years?
Maybe also being constant, because I believe that publishing it's a quite long process, and you have to be very patient and to revise again your paper. And I think sometimes I will get like, oh, a bit tired, but I think it was important to keep constant so I could have a nice finished paper by now.
Superb. Thank you, Victoria. Any other reflections on this one?
Can I give two pieces of advice?
You can give three. You can give three. Sorry, you can give three. Go ahead.
Okay. So first, I think that a piece of advice is to know who the other person is, to build trust, because there will be difficult moments when you have to run or you disagree about something. So you need to have trust to build that a trustful relationship. That is one piece of advice. And the other one is to keep always on your mind the schedule and the timing, because you think that is too much at the beginning and then there is not. So be always aware of the timing of this mentorship program.
Thank you, Sarah. Thank you so much. So I'm seeing some other comments from colleagues who have been mentors on this program. Dina, Tolib, thank you so much for being here. Let's respond to your questions. Dina, you make a very interesting point. You are speaking of the fact that really publishing the paper is just the first step, that we need to continue working together to help early career researchers to not only publish, but to actually promote their papers and then engage in the dialogue and become visible and really become peers in the field. And that this is a way of leading to the next paper. And that actually, this is something that female researchers typically don't maybe do sufficiently. And so that's quite a provocative argument, Dina. I wonder whether anyone on the panel wants to respond to that reflection. Sarah, you were nodding your head, so why don't you go ahead? And Trisha, I saw you shaking your head as well, and then Lynette maybe. So Sarah, why don't we come to you first?
Well, yeah, I agree with Dina. I mean, this is the first step, and the real challenge is that people read our papers. No, so I think that there has been some work promoting, for example, the webinar and the journal, and I think that we need more work on that and how to promote the work through social media. And yeah, I mean, I agree with that, and how we reach also the people from our own context where the research was done. For example, for many of us, the original research was done in non-English speaking countries. So we need to think also how to reach those audiences.
Thanks very much, Sarah. Trisha, did you have any response here?
Yes, very quickly. It is the beginning of the journey, which needs money and financial support to be able to even publish in some journals, get the exposure, be able to be part of conversations. I think that the research mentorship needs to be also aligned with the other type of professional growth mentorship, to see the junior researcher as a whole person, where research may be what they're primarily interested in, but to be able to grow professionally, there's a lot of different skills and values and core strengths that they need to develop: the resilience, the stamina, the ability to communicate well, to be very extroverted in a world where many may be introverted by nature. But how do you sell the fact that you are studying a certain topic, be on those boards, get into the review boards of those journals? Those are all components of becoming recognized as a thought leader and expert in their field. So to remember then that the mentorship needs to be that as well, whole, integrated, and complete, so that they can grow in every aspect and not become just someone who sits in their office writing papers, because that is not what is going to get their research out.
Excellent point, Trisha. And it's probably worth reflecting on this a little bit more. The fact that we do need technical mentorships, and this program is quite a technical one. But as we've heard from both the mentees and the mentors, that there's obviously a lot of other aspects in terms of competencies, in terms of skill sets that we need in that broader whole fully orbed, integrated way. And so how do we build those other kinds of mentorship? But there's a question in the box, which is, how do you actually find mentors? So if you don't have a structured program such as this, how does one actually go about finding a mentor? So maybe we can hear that from the panel as well. But I see, Sarah, both you and Sally have your hands up. So let me take your comments. I'm going to come, Lynette, Victoria, and Mariam, back to you in a moment. But Sarah, why don't you go ahead?
Yeah, I want to comment on the previous topic, and is this idea of other types of mentorship. And I think that there are other capacity building programs that we can connect with. For example, Emerging Voices for Global Health, that is a thematic working group of Health Systems Global. And in that capacity building program, there's some training relating to how you can raise your voice and communicate your research with different audiences. So I think that we need to create more connection and collaboration also between capacity building programs.
Thank you, Sarah. And Sally?
Yeah, again, a similar point in terms of amplifying voice and getting the insights, the conceptual, the empirical, the practical and pragmatic insights from these papers where they need to be. So I think we all take the challenge to amplify each other, put it out there on social media. But these papers are about health equity, right? And access to services and caring for underserved populations. So who are the communities, the health providers, the policymakers, the practitioners that we need to engage with, who may or may not be reading academic papers? What other sort of dialogue should we be having? Are there other ways to distill the learning? Should we be looking at policy briefs, podcasts, engagements? You know, all of you first authors, you know your contexts, you know your policymakers and practitioners. What will appeal to them? How can you get your key messages and your evidence accessible and useful and used? And Sarah, I also really like the way you referred to the range of TWGs and others that are there through Health Systems Global. They are a community for all of us to build on and to link to. But please take the challenge to think very pragmatically about policy and practice influence too. Thanks.
Thanks very much, Sally. And I mean, that point underscores for us the fact that it's not just early career researchers or emerging researchers who need to learn how to dialogue with other communities and other stakeholders, particularly as communication changes, as technology changes, as various platforms for engagement change, regardless of the position or the level of experience in your own policy or practice sphere. There are new things emerging in this modern world that we live in that all of us need to learn how to do that better. So very important point there. Tolib asks a question about learning from future initiatives and what sort of key insights you might have in terms of how can we maybe take the learnings that we've had or the insights for future mentorship initiatives. So I wanted to come back, Lynette, Victoria, and Mariam, to you to hear what your thoughts are. If you were to design this program next time, having gone through it this time, what would your insights for improvement or change or deepening be? Victoria, why don't I start with you?
Sure. I think I will have more of these type of spaces where we can share, because I believe that like we were talking beyond the paper, this type of qualities to actually share your work or to connect with other researchers are really important qualities in the professional area. So I will try to make more of these spaces, and actually they help me a lot. For example, I am really shy, and I had been working a lot on how to speak in public, especially when I'm sharing my works, and this type of experience have helped me a lot.
Thank you, Victoria. Mariam?
For me, I think what I would include is a more stronger link between the mentees, because it feels somewhat a lonely process when you're writing the paper, because at least if you are linking up with the with fellow mentees once a month or however times, it gives you the sense of at least okay, at least I'm not alone in this at this stage, or how can I support my fellow mentee in, because sometimes it felt like, oh, I'm so behind or I'm way ahead, because there was no communication between the mentees, at least on my end. So it would be nice to have some sort of a platform where the mentees are able to communicate with each other to keep up with what's going on. Yeah.
Thanks very much, Mariam. And Lynette.
Yeah, I think for, I don't want to retaliate on whatever Mary has mentioned. I think in our experience for this cohort, I think we had one face-to-face session. So I think having, I know budget is a constraint, but I think having, if it's one, probably a longer session, probably a week with a very clear deliverables, so that mentees and mentors can actually interact more than just a day or two, because then you realize that it's true as what Tricia said, not all the mentors or mentees will be your friends or are your friends, or you know them in a previous life. But I think when you interact, then you become a cohort, and it's easy to reach out even to another mentor who is not necessarily your current mentor as you're doing your work. And that makes work easier, or rather you learn from many people. It's now easier to contextualize issues and make your work better and easier. It's true, it was a lonely process. You're there in Kenya, and you're writing, and you're thinking, what level are my colleagues or fellow mentees in terms of presentation? Were they able to even do the introduction? So I think making it more inclusive, people working as a group would be better and make it easier. Thanks.
Thank you very much, Lynette. Thank you, all of you, for those reflections. I think this point, and Sally raised it earlier, that cross-learning, I mean, that those few hours that we had together when we were in Bogota were quite enriching for all of us. Of course, the mentor-mentee dyads have been working very intensely and knew each other, but to just have the opportunity to just get a bit of a new or fresh perspective, both for the mentors. I had the opportunity to work with one of the authors, and it was really interesting for me as well. I learned in those few hours. So I think absolutely, in as much as it is valuable to have the dyad, it is equally valuable to build in the time for that cross-learning. So these are important reflections. I suppose there's another question that has been raised by the earlier discussion, and Victoria, it was you, I believe, who spoke about finding your niche in health policy and systems research. And I wanted to open that up, both Lynette and Mariam, to you to think about, as you have now started this journey of growing in your research ship and your emerging leadership. How are you navigating and finding your way in this field?
Yeah, I think one of the ways of navigating this is, first, you do what you like and what you know best. I think then it saves you the energy to be learning so many things. So it's easier to transition from what you know to what you don't know. So in my context, anything around community health is what I do on a day-to-day basis. So it's very easy to triangulate that in the context of research. And I think for anyone who is doing research for the first time, it's easier to move from known to unknown. So have an expertise in your area and probably build on that as you transit to areas that you've not worked in before, you don't know.
Thanks very much, Lynette. And Mariam?
I think for me, I can also echo Victoria's experience in that. Her coming from the sociological background, coming from communication. So it is it's also been quite difficult for me to find my space within policy and research. Trying to I guess convince people to take me seriously, and that with my background, I can use that to bring a different perspective to the conversation. So for me, I think it's when you get, like, for example, with this program, what it's done for me is it's given me access to certain people that I would not have had access to. So that with that door open, then trying as much as you can to engage with them in whatever small or big way, in order to convince them that yes, my field also has space in this field, and that have studied public health or global health or anything related to it, in order for you to contribute to this space, because I think these things affect every single person. It's so that's what I can say.
Excellent. Thank you so much, Mariam. Maria, you have a reflection on this.
Yeah, I think that sometimes at the beginning it's difficult. It's like I like research, I like public health, global health, but like you don't find your spot. It's like I like it, but I don't know how to get into. So I will say that as Lynette mentioned, sometimes you are interested like in a topic, like a disease, a group of a specific vulnerable group, for example. But sometimes also you are interested in a specific method. I like qualitative research, systematic reviews, etc. And you can use that method in different topics, in different diseases. So I think that it's important to explore what you like, what you want to do. And then when you start doing that, you will like discover a more broad world. And also when you go in deep doing this, you will find also the needs that exist in terms of research. To add to a question about how to like reach a mentor, I think that if you are interested in a topic or in a method, like send a message. If you find someone that is doing that, you send an email. If you are in a conference and that person is there, even when you are shy, it's like go and say, hi, I really like your work. Can we work together like in distance? I can do this. So usually people is very open, and usually people will say yes. And if they say no, you only lost your time and nothing else. So I will I will push you to do those kind of things.
Thanks very much, Maria. I'm laughing because I thought I was the only introvert in health policy and systems research, but I learned today that there's at least 10 of us. So that will be the next mentorship scheme. But as we wrap up this really wonderful panel, and I'm going to come to each of you just to give a final reflection, but we've heard so much in this past hour, and it's been quite interesting because we've started with the personal and heard from each of you in terms of why you wanted to be mentored, why you wanted to mentor, why you wanted to be involved in this scheme. And we're hearing this interplay between sort of the personal aspirations, but that seated in and being embedded in organizational context, broader context where we come from, our countries, our families, our disciplines, and how all of that sort of comes to bear on this process of mentoring, and that this process really is dynamic in the sense that it moves with time as the mentee becomes a mentor, as the mentee slash mentor thinks not only about the technical skills, but also about the broader skills needed to be able to continue to interface with the field, with the science, with the practice. We haven't been able to solve everything in this panel, but we've spoken about trying to redress not only the gendered issues as they pertain to this field of health policy and systems research, global public health, but also the issues as they relate to equity in terms of the topics, and how do we actually redress equity in all of the diverse ways, the various barriers, the various populations, the various ways in which certain methods will allow us to ask different kinds of questions. And so again, I want to congratulate you. I want to congratulate all of the authors and your co-authors for really putting together a really excellent body of work that will make very real contributions to how we think and understand what equity means in this field. I want to congratulate the guest editors for having so expertly and sensitively put this collection together and making it cohere. And I want to congratulate also the mentors for your continuing contributions to supporting new generations of researchers, and also want to congratulate Health Policy and Planning for the ways that you are making publications and that whole process much more accessible. So with that, let me come in turn to each of you just to share a final thought or reflection with us, and then we will hand back over to Nanuka. So Mariam, why don't I start with you? Any final reflections, either from today or from the entire process? Mariam, I think you're still on mute.
Oh, sorry. Thank you very much for the question. I think for me, it's been a wonderful experience, because I've been able to gain different perspectives, not only from my my assigned mentor, but I also was able to be mentored with other mentors within the program, and it was a wonderful experience to have been able to go through that, to be able to, because I'm from down south, so being to gain the perspective of like the European perspective and the North American perspective, it's really enriched my skills in ways that I never imagined I would gain when I was entering this program. So thank you very much to the HPP, the Alliance, and the HSG for this great opportunity that you presented me. Yeah, it's been a great experience. That's what I can say.
Thanks very much, Mariam. Victoria?
I think one big reflection I have from this session and in general from the mentorship is that the process of learning is multidirectional. So I think the mentees learn a lot about the mentors, but we also learned about the other mentees, and we learned about the whole process at itself. And I think this had brought several lessons both to mentees and mentors, and I think that is great. I feel it like this big learning process for all of us.
Thanks very much, Victoria. Lynette?
Yeah, I think my reflection here is that, this mentorship program is an interesting program, and I think a way to make people who have wealth of knowledge and are shy to actually share this information, at least support them to make a first step to having a documentation, publishing and making their work known to others. But I think secondly is also a good platform to bring on newer or younger career researchers and onboard them. So as the mentors transit, then we have an able team that then can carry on the mentorship program for the younger or the upcoming team members. I think congratulations to all of us. I think it was worth to just make a dedicated 2 years to walk the journey. Thank you.
Thanks very much, Lynette. Sarah?
Yes, my final reflection is that we, both mentors and mentees, should keep disseminating this work, and I mean all the things that we learn. As Sally mentioned, also mentors learn a lot from this process. So I think that for me, the next step and challenge is to disseminate this with our research teams in our own settings. And yes, keep dreaming, keep working, and keep networking.
Thanks very much, Sarah. Sally?
So like others, a big thank you to everyone, a big congratulations to everyone. We all learn through mentorship, the mentees, the mentors, and let's keep going on that learning journey. I think it's really important to addressing gender inequities in the research process and is a critical way to promote research legacies and capacity strengthening. So thank you.
Thanks very much, Sally. Maria?
I think that as for the mentees, this was their first publication. For me, it was my first opportunity to be a guest editor. So this has been very enriching, and have the opportunity to do this in a program that is so well organized with a very nice co-guest editor. We share a lot with Trisha. So I think that, as Victoria mentioned, with this process, all of us have learned a lot. I will give a call to have more platforms like this to provide more opportunities to young people, men, women, and also opportunities to researchers for as me to be a guest editor, to be mentors. I think that this is a great opportunity for a lot of people. So thank you so much, and congratulations to all of you for your first publications.
Thanks very much, Maria. And Trisha?
Congratulations to everyone for the time it took and the sacrifices and the energy and the resilience to get to this point of having the paper published, both to the mentees and to the mentors. I have two favorite moments I would like to mention very quickly. The first one was my work with Maria in general, but especially when we were working together on the guest editorial, to see how our minds work differently in certain ways, but came together as far as how we would look at and present the journal to others. And I think that I really admire her science and her way of approaching this type of work. And I believe that we will stay connected, especially as we move forward. My favorite moment was during Bogota. I wasn't able to make it, so I worked with another young woman researcher online, and she was at her kitchen table. She had a child nearby that was an infant. She had another child running around the room. There was a point where her partner came in, the husband came in and pulled somebody away, and she was bouncing someone on her knee, and the signal didn't always make it. That frame of that picture of a woman with so many competing interests, deciding that this was so important that even the people that came from her, the children she bore, needed to be set aside just for a minute so she could focus on this that was so important to her as a woman and as a professional. And that to me spoke volumes about the value of this program and the hope that it can be amplified and extended so that many others just like her, just like us, find the support we need, that little nudge, the push, the call, the challenge to be able to move forward in something we care so much about. So thank you for allowing me to participate in this and hoping that we continue to do it as we move forward.
Thank you very much, Trisha. Thank you for grounding all of this in a very real and very beautiful image. Thank you so much. So as I hand over to Nanuka, I want to thank all of the panelists once again. I want to thank the audience. Thank you for all of your questions. And there are many questions about when can I sign up? How do I be a mentee? When's the next iteration? And so I'll respond to that in just a moment before handing over to Nanuka. But as I welcome Nanuka, I also want to thank Health Systems Global, without whom and without our partnership with them, this program would not be what it is. Somebody mentioned how much they've enjoyed just how well organized this program has been. And that is a testament to Nanuka Jalagonia, who has managed this program over the years. And we've really worked together to build in what we've learned running this the first time. But the excellency of the program is because of how excellent Nanuka is. And so Nanuka, we want to thank you as well for keeping us on timelines. So let me just respond to the question about how do we get more information? How do I become a mentee or a mentor? When is the next iteration? We are hoping to be able to run this program again. And so we will just ask you to bear patience with us while we explore the timelines and what that would look like. If you do want more information on previous iterations, you can always find that information on the Health Systems Global page, where it does outline the calls for proposals, which has the criteria, and that will give you a bit of a sense of how the program is constructed. You can also read the publications that are a product from the first cohort. So thank you everyone very much. And with that, Nanuka, we hand over to you. Thanks.
Thank you so much, Aku, for a fantastic job you did to moderate this very engaging panel discussion and Q&A session. And thanks also for your summary of this insightful discussion. This is much appreciated, and huge thanks also to our panelists and the audience for making this 90-minute webinar, which is quite long, very interesting and engaging for all of us. And before I go to the closing, I also want to extend my thanks to my Health Systems Global colleague, Joanna Manga, who worked in the backgrounds, but all mentees know her from the inbox and had the privilege to meet her in Bogota in person. So, and the insights that we hear today will continue to unfold, as Aku has mentioned, with more voices from this cohort set to echo through blogs, podcasts, and the papers. And also there will be a mentorship survey coming to your way next week if you're an HSG member. And please participate in this survey and mark if you want to join future mentorship initiatives as a mentor or mentee. You will also be asked to mark your areas of expertise or the areas where you want to strengthen your capacity. So please stay attentive to our emails. And after hearing from health policy and planning colleagues, the Alliance colleagues, mentors, mentees, and guest editors, now our focus turns to the launch of a special issue, delving into a wide range of equity-oriented topics. And this collection of papers, as already mentioned by my colleagues today, explore access to quality services and care for underserved populations. And all these topics are uniquely interpreted through the lenses of early career women, our mentees, who actually live and work in these settings. So I encourage you to go and check the chat box for the supplement link and save it for further reading. And I also encourage you to stay engaged with Health Systems Global and the Alliance Twitter accounts and the website for more enriching content to continue today's discussion. Well, I think that wraps things up for today. Again, I want to join Aku and my other colleagues in congratulating once again to everyone involved, the authors, editors, participants, guest editors, health policy and planning team, and our colleagues from the Alliance and HSG for the success of this program, but also for the success of this journal supplement. Thank you, everyone, and wishing you all a wonderful weekend. Thank you. Goodbye.
Thank you.
Thank you. Bye-bye.
Thank you. Bye.
Everyone.